My name's Naomi. I'm a student LPN at NBCC, and I'm doing a neurological assessment.
Okay.
Okay, so I'm just going to ask 3 questions to begin. And the first question is, have you ever experienced difficulty with coordination or with feeling clumsy?
No.
Okay, that's good. My next question, do you have a history of heart disease or diabetes?
No.
Okay, good. Have you had any recent headaches?
No.
Alrighty, that's good. Now I'm just going to ask you a few questions to test your cognitive function. First question is, what is today's date?
It's June 12th, 2020.
Alright. What is your favorite color?
Blue.
Alright, and who is the current Prime Minister of Canada?
It's Prime Minister Justin Trudeau.
Okay. Can you tell me who I am?
Naomi Solomon.
Right. And can you tell me why you were here today?
I'm here to assist you with a video for a neurological assessment.
Alright. Okay, and I'm going to ask some other questions. Have you experienced any change in your mood, such as feeling depressed or anxious, for longer than 2 weeks?
No, I've been good.
That's good, that's good. Have you lost joy in activities you used to love to do?
No.
Okay, that's good. Have you had any thoughts of harming yourself or others?
No.
Okay, that's good. That concludes our cognitive function. Okay, so now we are going to continue with assessing the cranial nerves, and I will be assessing 5 today, and those are going to be the glossopharyngeal nerve, the optic nerve, spinal accessory nerve, oculomotor nerve, and the trochlear nerve. Is there any questions you have about these?
Yeah, can you tell me and elaborate more on the function of these nerves and what kind of tests we might be doing?
Of course. So for the glossopharyngeal nerve, that has to do with your swallowing abilities, and it also has to do with your gag reflex.
Okay.
And the way that we will be testing those today is I will get you to have a sip of water and swallow that, and we will assess how easy it was to swallow it and that you didn't have any hesitation or trouble. And then for the gag reflex, I will be using a cotton swab, and I will just stick that at the back of the throat, and it will make your gag reflex react, the nerve there. For the optic nerve, that has to do with your sight and how you can see. So like whether you would need glasses because you can't see from far away or you can't see things close. And we'll be testing that with a Snellen chart, which is like when you go to the eye doctor and they get you to read off the letters from big to small. And then the next one will be the spinal accessory, which has to do with your sternomastoid muscles and moving your neck and your shoulders. And the way we are going to test that today is I'm going to put my hands on your shoulders, and you will try and resist the weight. And the same with your neck. I will put my hand on your face, and you will resist against my hand.
Perfect.
And for the oculomotor, that has to do with your eyelids and opening and closing. And it has to do with your pupil reaction. So when you close your eyes and you open them, they should react to the light coming back in.
Perfect.
And we'll test that by getting you to open your eyes, and I will see the change shape, and also your motor function will be tested by just getting you to open and close your eyelids, and I will see that they are functioning properly.
Perfect.
And I'll also be looking at the shape of your pupil for any abnormalities or anything like that. And then the last one is the trochlear nerve. So that has to do with the muscle in the eye that makes you able to move your eyeball to see in other directions. And the way that I'll be testing that is I will be getting you to look over as far as you can in certain directions, and that will tell me whether that function is working properly.
Okay, straightforward. Thank you.
Okay, so now we're going to test the first nerve, which is the glossopharyngeal, and you understood when I let you know about the functions?
Absolutely.
Okay, so I'll just get you to take this, and I'm just going to get you to take a sip of water.
Okay.
And I'm going to observe. Okay. Looks all good.
Okay.
And now I'm going to test your gag reflex, and I'm just going to put this at the back of your mouth. Is that okay?
Yeah.
Okay. Okay. That's done. And I would have used a tongue depressor, but I don't have one, so I just used that. The next one we're going to check is your optic nerve. So now we are going to be testing your optic nerve, and I'm just going to get you to look at this chart here, and I'm just going to get you to say the first 3 letters here.
R-I-C.
Okay, and the next line.
A-I-S-T.
And the next line.
H-E-O-N-L.
Okay, and the next one.
Y-E-C-O-N-O.
Okay, and below that.
M-Y-T-H-A-T-I.
Okay, and
N-I-N-E-E-D-T-O-G-I.
okay, and right below there.
Y-E-M-Y-A-T-T-E-N.
Okay, and the next.
T-I-O-N-T-H-I-N-G-S.
Okay. So your eyesight's pretty good, but you mixed up your V and your Y.
Okay.
All right. Okay, so now we're going to be assessing your spinal accessory. So that's the sternomastoid muscle.
Makes sense.
Okay, so I'm just going to place my hands on your shoulder. Is that okay?
Yeah, go ahead.
Okay. I'm just putting my weight on there, and I'm just going to get you to resist and lift up.
Okay.
All right. And now I'm going to put my hand on your face. Is that okay with you?
Yeah.
Okay. And you just have to resist and move your neck the other way towards my hand. All right. Do the other side. All right. Seems to be working well. Okay, so this next one is your oculomotor nerve. So what I'm going to get you to do is to close your eyes and open them.
Okay.
Okay, and I can see that your eyelids are moving normally, and you're able to open and close your eyes normally. Now I'm just going to get you to close your eyes for just a few seconds. I'll let you know when you can open them. Okay, you can open them now. Okay, and I see that your pupils reacted normally to the light coming back in. And your pupils are also a normal shape. They're not abnormal in any way.
That's great.
And that concludes the oculomotor nerve assessment. Okay, so now we're going to do the trochlear nerve, assess the trochlear nerve. So what I'm going to be getting you to do is, while you keep your head straight and your neck, and don't move your neck or your head, I'm just going to get you to look over to your left as far as you can, just moving your eyeballs and keeping your neck and your head straight and not moving.
Okay.
Okay, I'll get you to do that now. And now I'll get you to look over to the right. And then I'm going to get you to look upwards. And then I'll get you to look downwards. Okay, towards me. And I see that your eye movement is perfectly fine.
Okay.
And you're able to bring it back to the normal sight. And that concludes the trochlear nerve assessment. Okay, so now I'm going to test for light touch sensation. So I'm going to get you to close your eyes.
Okay.
And I'm going to be touching you with a cotton swab very lightly. And when you feel it, say yes. If you don't feel it, say no. And I'm going to be alternating as well.
Perfect.
Okay, so I'll get you to close your eyes.
Yes. 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 Yeah. Yes. Yeah. Yes. 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 Yeah. Yeah. Yes. 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 Yeah. Yeah. Yes. 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 Yes.
Okay, that concludes that. Okay, so we finished the light touch sensation. Would you be able to tell me the spots that I touched the cotton swab to you?
Yeah, absolutely. So my forehead, my cheeks, my arm, my inner arm, elbow area, my thighs, inner thigh, knee, my shins, tips of my toes, and that's it.
Okay, that's good. Okay, so now I'm going to be doing the pain sensation assessment, and I'm going to be using these tweezers, and one end is sharp and the other end is dull.
Okay.
And I'll be pressing that onto your skin, and I'm going to get you to tell me whether you feel that it is sharp or dull, and I will be getting you to close your eyes during this, okay?
No problem.
All right. So let's start.
Okay. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay. That concludes that assessment. Okay, so I'm going to do a couple tests or a couple assessments for kinesthesia sensation. So the first one I'm going to do is I will be moving your arm.
Okay.
in a certain direction, and I will want you to move your other arm in the same direction.
So mimic the same movements as you're doing with my other one.
Yes, exactly.
Okay.
Okay, and while I'm doing this, I'm going to get you to close your eyes.
No problem.
Okay, is it okay if we start?
Absolutely.
Okay, I'm going to take your left arm here. Right. All right. Now this next one I'm going to do is I'm going to be testing your muscle function. So what I'm going to be doing is you're going to resist against my hand, and you're going to press as hard as you can. And is it okay if I place my arm against your chest?
For sure.
Okay, and the reason I will be doing this is because if the person does have abnormal nerve function, they will end up maybe hitting themselves. So I will start by just doing this.
So pull towards me.
Pull towards yourself as hard as you can. Okay. Okay, and he's all good in that sense. And that concludes the kinesthesia assessment. Okay, so now I'm going to do a stereognosis sensation. So what that is it is the ability to feel 3D objects.
Okay.
So what I'm going to do is I'm going to place something in your hand, and you will close your eyes, and you will feel the object, and you will let me know what it is.
No problem.
Okay. So I'll get you to close your eyes, and we're okay to continue?
Sure.
Okay.
I'll just place my arm out.
So I'll just get you to use one hand.
One.
Yeah.
One hand to feel the object as well.
Yep, I will place it in your palm. Okay, and feel it.
Oh, there. So it's a paper clip.
Okay. Right. And put your hand out again.
Same one?
Yep.
It's a hairband type rubber.
Yep.
Or elastic. Some sort of card.
Yep.
Plastic. It's a lighter.
Very good. And last one.
Okay. It's a cotton Q-tip.
Yes. All right, you can open your eyes.
Okay.
Was that good?
Absolutely. No problem.
Okay. Okay, so this next one we're going to do is graphesthesia. So what this is it is the ability to feel the sensation of numbers drawn into the hand. So what I'm going to be doing is I'm going to be getting you to put your hand out, and you'll close your eyes, and I will draw a number, and you will tell me what it is.
Sounds good.
Okay, you ready to
Yeah.
proceed? Okay.
The number 8. 10. 22. 5. 4. 7, 6, 9.
Okay, you did great. Okay, so now we're going to assess your balance. So what we're going to be doing is something called a Romberg test, and what I will be getting you to do is to stand with your feet together, and I will be getting you to close your eyes, and that will be testing how long you can stand before you start to sway or fall.
Okay.
Okay, and the second one is going to be the head to toe walking, and that is also going to assess your ability to balance. So we're going to do that right now. I'll just get you to step off.
Can you just demonstrate for me though first?
Of course. Okay, so the first one, the Romberg test. Is going to be your feet close together.
Okay.
With your arms by your side, and then you will have your eyes open for a second when you're getting yourself ready, and you will stand with your eyes open for a few seconds, and then I will get you to close your eyes.
Okay, makes sense. No problem.
Okay,
And then the other one.
The other one.
Head to toe walking, I think you said.
Yeah.
Okay.
Or heel to toe
Heel
walking.
to toe.
Yeah.
Okay.
So that will be standing straight, and you will have your heel to your toe, and you will walk like so.
With my eyes closed or open?
With your eyes open at first, and then after that we will have you close your eyes, okay?
Okay.
Okay, and just like that. And then I will be right here as well in case you fall. So now you will close your eyes.
Okay, makes sense.
Yeah.
Let's try.
Okay, so I'll just get you to get here. So the first thing we'll do is the Romberg test.
Okay.
So feet straight together, including your toes together. Okay. Okay. We're all good there. Okay, and now I'm going to get you to do the heel to toe walking.
Okay, so eyes open first, you said?
Yes, eyes open first. Very good. Okay. Now I'll just get you to go back, and now just do it with your eyes closed. There you go.
Okay.
Great. Okay, so now we're going to be testing your fine motor skills in your upper extremities. And what I'm going to be getting you to do is to touch your finger to your nose, and then your finger to your nose, then to my finger. Okay?
Okay.
Okay, so what you're going to do first is you're just going to touch your nose, your finger to your nose, and away.
Okay.
And then I will place my finger in different areas, and you will touch your finger to your nose and from your nose to my finger, okay?
Too easy.
Okay. You ready to begin?
Yeah, that's cool.
Okay.
Please.
Okay, you can start. That was good.
Okay.
Okay, so the next assessment we're going to do is, it's also a fine motor skill assessment. What I'm going to get you to do, it is called a thumb to finger test. And what I'll be getting you to do is have your thumb in the middle of your hand,
Okay.
and touch your fingers.
My fingers. Okay.
And alternate.
Both hands at the same time, or
No.
just separately?
Just one hand at a time.
Okay.
Okay, so
Ready?
are you ready to begin?
Okay.
Okay.
Pinky first.
Okay, I'll just get you to do it on your other hand.
Okay.
Alright, that's great.
Okay.
Okay, so now I'm going to be testing your knee reflex or patellar reflex. So what I'm going to be doing is I'm going to be striking just below your kneecap on the patellar tendon. And what that will do is it will have your leg, your knee will jerk out and your leg should lift up. And what I will be seeing is I will be seeing your quadriceps tense up as it jerks out. And that will show me that everything is working, everything is reacting normally, and your reflex is fine.
All right.
So I'm going to do that. Just a second. Okay. So all I have to do is just find the... Okay. Right, that's all good. Reflexes are good. Okay, so that concludes my neurological assessment. And according to all the assessment data that I collected, his neurological function is stable. And he has no problem with his sensory function or his motor function. All his reflexes are fine. Everything is responding normally. Thanks for watching.